In Rochester, New York, the Aspire HD unit has been tested by several radiology specialists. We headed to the Elizabeth Wendy Breast Care Center and talked to Dr. Stamatia Destunis, one of the leading radiologists nationwide. She sits on medical advisory boards for several breast imaging technology companies and is the principal investigator of several ongoing research projects.
I'm Dr. Stamatia Destunis. I'm a diagnostic radiologist at the Elizabeth Wendy Breast Care in Rochester, New York. I'm the managing partner here, and I have been here approximately 20 years. I'm a fellowship-trained breast imager, and I work exclusively in diagnostic mammography. Our center focuses on screening mammography. That is really the screening tool that we utilize every day. As a group, there are several radiologists that work in our facility, and we see approximately 300 patients a day for screening or diagnostic mammogram. We very much believe that in order to stay on the cutting edge, you really have to work with different vendors, different technologies, and really know what's out there, what's being developed, what's being implemented. So we basically have performed several clinical trials over the last several years. Since the fall of 2009, we have an Aspire HD has been placed in our facility, and we've been working with some clinical research and really getting familiarized with the image quality and the technology itself. I think for anyone that's considering transitioning their facility, their hospital, their department, their mammography department into a digital department, I think Aspire is really a very nice way to introduce yourself into the digital technology. It's easy to use for our technologists. The positioning is very easy. The image processing and image acquisition is very quick, and it's very easy for the radiologist to interpret. We have a third-party PACS, and it's very easy to interpret on our third-party PACS. So I think it would be very easy for a facility that's transitioning to digital to go with Aspire HD, or if they're interested in purchasing new digital equipment, perhaps for outdated equipment. So you don't have to go buy all Fuji equipment, let's say. You're able to utilize the PACS that you have, whether you have radiology PACS in a hospital setting or you have a mammo-specific PACS in your outpatient facility. So we've been able to utilize what we have currently in our office. I have a lot of friends that are radiologists that do mammography in different parts of the country, and they have been on the fence whether to transition to all digital, or they're 50-50 digital, 50 film, or they only have a small amount of money, or they're in the budget, they ran out of money. I do think that when they are able to move on to transition completely, or to move an old unit out that's film with digital, Aspire HD will be a great choice.
The new Aspire HD unit has been tested and recommended by leading U.S. radiologists. Now, it has finally been introduced to the U.S. market and is available to all radiology departments throughout the U.S.